Today, we'll be talking about post-traumatic stress disorder for urban youth. Post-traumatic stress disorder can be defined as a traumatic stressor involving direct personal experience, witnessing, or learning about events and situations involving actual or threatened death, serious injury, or a threat to one's physical integrity. The symptoms of post-traumatic stress disorder, or PTSD, include reoccurring unwanted memories, distressing dreams about an event, flashbacks, intense psychological distress triggered by exposure to events, and marked psychological reactions, internal or external, may develop. The prevalence of trauma for inner city and urban youth is very high. Nationally, 83% of inner city youth reported experiencing at least one or more traumatic event. 1 out of 10 children in a major American city report witnessing a stabbing or a shooting. 59% to 91% of children and youth in the community health system report trauma exposure. 60 to 90% of youth in the juvenile justice system have experienced traumas ages 12 to 18. Gender-wise, urban males experience higher levels of exposure to trauma, especially violent-related incidents, while females are 4 times more likely to develop PTSD following exposure to traumatic events. Studies show that 15% to 43% of girls and 14% to 43% of boys go through at least one trauma. Of those children and teens who have had trauma, 3% to 15% of girls and 1% and 6% of boys develop PTSD. Rates of PTSD are higher for certain types of trauma survivors. In the state of Maryland, the Baltimore Sun reported that 46% of youth experience a traumatic event. In Baltimore City, data from the Baltimore City Health Department shows that 31% of children in Baltimore have experienced ACEs, which stands for Adverse Childhood Experiences, meaning trauma in their childhood. When seeking treatment for PTSD, the CDC advises first to talk to a healthcare provider to arrange an evaluation. Once a diagnosis is made, the next step is to make the child feel safe and have support from parents, friends, and school, and minimizing the chance of another traumatic event to happen. Therapy and interventions also include psychotherapy, which allows the child to talk, draw, play, or write about a stressful event. The goal of psychotherapy is for the patient to realize the traumatic event has governed his or her life, but the PTSD symptoms and the traumatic event are now in the past. The last 4 therapy treatments and interventions are behavioral therapy, cognitive processing therapy, prolonged exposure therapy, and brief electric psychotherapy. Behavioral therapy helps children learn to change thoughts and feelings by changing behavior in order to reduce their fear or worry. The goal is to encourage them to stop using unhelpful strategies and begin using new behavioral experiments to overcome their impact. Cognitive processing therapy is kind of similar to behavioral therapy, but with a different twist. The goal is to modify beliefs related to the tragic event and learn coping skills. Prolonged exposure therapy involves teaching individuals to gradually approach their trauma, memories, feelings, and situations. It's broken down into two different pieces: imaginal exposure and bio exposure. The goal is for the individual to learn that their memories and cues are not dangerous and do not need to be avoided. Lastly, brief intellect psychotherapy aims to change the painful thoughts and feelings that are the result of a traumatic event. The goal is to focus on the emotions and shame and guilt of the individual. Within treatment, it's important to recognize culture. Culture recognition plays a major part in effective treatment. It's imperative to be aware of the music that our youth are listening to, the clothes that they may wear, what they may eat, their community, and just their daily way of living. In conclusion, ultimately, we want to practice prevention. Even though there are sometimes biological factors that contribute to PTSD, it's important that we protect our children, protect them from maltreatment, violence, injuries, and try our best to lessen the impact of unavoidable disasters. Thank you.